Hello friends, I am Dr. Gaurav Agrawal. I am a pediatric cardiologist working at Children Heart Care, New Delhi. Today I will discuss an interesting case. That patient was of 50-year-old. The patient was not of small child, but instead he was of 50 years old patient. The patient came with a history of difficulty in breathing on exertion, and we advised the echo study, and then we found that the pumping of the cardiac chambers is very bad. Approximately 30 to 40% were cardiac pumping. Normally there is a pumping of 55% and more in normal patients. And simultaneously we found that there is a hole in the heart that is known as the patent ductus arteriosus. We could not measure the size of the hole because the echo windows and cardiac windows were very limited. The PDA, what is the meaning of PDA? PDA is a hole between two great vessels of the heart. One is known as the aorta and another is known as the pulmonary artery. As you can see in this picture, normally this hole presents in first year of life, either in the form of frequent cough and cold, difficulty in breathing, pneumonia-like situation, but unfortunately, this patient was not diagnosed till 50 years of age. This is very surprising for patient also and for us also. We evaluated the patient because we could not measure the size of the PDA on echo. We advised the patient to undergo for CT scan. On CT scan, we measured the size of the PDA was 8 mm. That is very big. And fortunately, this patient is still operable. Means we can do something for this patient. Otherwise, 8 mm PDA generally went into Eisenmenger-like situation within first 2 years of life. But God was great. In this patient was operable. Now the question comes, what can we do for this patient? There are two options. One is open heart surgery, or by thoracotomy from the backside we can ligate this PDA. But as the patient was big enough, and so we decided to close this hole by putting a device across this hole known as the PDA device closure or transcatheter method for closure of PDA. After shifting the patient to the cath lab, we took only one vessel from the leg, that is known as the femoral vein, that is connected with the heart. We tried to define the size of the PDA by this method only, but we were not successful. Fortunately, we were able to define the location of ampulla by this technique, by doing angiography. Then we were decided to use 16x4 ADO1 device. We deployed the device across this hole, and we did the echo to see the device position and whether there is any leakage across the device or not. But as the echo windows were very limited, we could not define the size, we could not define the same thing. So we took another vessel from the leg, that is known as the femoral artery, that is also connected with the heart. After taking this access, we did the angiography by pictorial catheter, and we defined the device position. That was okay for all of us, and there was no residual across this device. Finally, we released the device and patient shifted back to the ICU for a few hours, then shifted to the room and discharged next day. On follow-up, the cardiac pumping of the patient is improved a little bit because the pumping was very poor. It will take a little longer time to improve, and there was no residual across the device, and the patient is currently on medications, and the patient is on regular follow-up. The message from this video should be that if any patient is having recurrent cough and cold, difficulty in breathing, pneumonia-like situation, difficulty in feeding, especially within first few months and first year of life, then the parents should consult with the pediatric cardiologist to rule out any congenital heart defect in the baby. Thank you very much. For more detail, you can log into my website childrenheartcare.com.